Should we get going? It's 10 o'clock. Thank you everybody for tuning in this morning. We have Chris Galler here. Jen, do you want to introduce Chris?
Sure. So Chris Galler is a Chief Executive Officer for the Minnesota Association of REALTORS, and he's been in the real estate industry since 1985, and he's been working with the Minnesota Realtors Association since 1996. He also teaches a variety of real estate industry courses for the last 15 years, specializing in agency law, demographic trends, fair housing, industry changes, and legislative issues. So today he's going to talk to us more about the COVID-19 and the Minnesota Realtors Association and what we can expect moving forward. So thanks for being here.
No problem. Happy to be here. I'll pull up a PowerPoint program quick. Starting to share. Do you want to continue? Yes. And there it is. So hopefully everybody can see the screen, and let's see. I wonder if I can start this. There. Everybody see it all right? I'll assume you do. So we'll talk a little bit about COVID-19 today and the Minnesota real estate market as we go forward. We'll look kind of at the early days. We'll look at essential employees. We'll look at a new normal, and we'll discuss kind of the marketplace going forward, some of the things that I think you're going to see as a result. First of all, we have to all start at the beginning of the year, and who would have thought in January or February, as you were making plans for the year, that this would be such a significant change in how business would be done. And to begin with, we had MERS and SARS before. We've had other diseases like this, and yet they've never really panned out to the level that this one did. So I think across the board, there was a lot of public disbelief. There were certainly comments by folks that it wasn't going to happen. As we got into March and they started to make runs in the state, there was a prediction that Minnesota would have 75,000 people die from the coronavirus if no action was taken at all. And they reduced it then into the 45 range, and they've reduced it every period. In fact, we are right now just past the original prediction of when the peak was going to happen, when they thought there would be more than 1,000 people a day dying. I think it was 14 yesterday. Governor Walz issued a number of executive orders. He's in the 70s now. These are direct orders that he makes without any legislative input. He has the right under the executive order to do that, and he's been doing that throughout, holding a number of press conferences along the way. The original thought was we need to make sure that, unlike Italy and some other countries that were impacted by it, that we have enough hospital preparedness in order to make sure that if indeed there were a lot of people impacted by this type of a disease, we would have hospital beds. And if you listen to the conversations earlier, they were talking about using the Viking Stadium packed with beds around all of the stairways, down on the field. They were saying if indeed we're going to have 75,000 dead people in the state, the number of folks that would be in ICUs would be even significantly higher than that. And so the real concern was we need to flatten the curve, not have a big spike, and not overwhelm the hospitals. And so they've been doing that over time. Unfortunately, one area that was significantly impacted, and it's still significantly impacted, are seniors, and especially those in nursing homes. And if you look at the counts and the numbers of where they're coming from, senior citizens, especially those over 80, and nursing homes have been I mean, if indeed you were going to make a bet and you said, hey, I think I'm going to move into a nursing home and I've got some prior conditions, your likelihood of making it out probably isn't real strong. And so we've gone through that. The governor has started to make some adjustment in that, although there's still significant concerns about the nursing home area. And it's important to understand one of the reasons for the nursing home problem is home care providers and nurses providers that they have in those facilities. Many of them work in more than one facility. They're not highly paid. It's a stressful job, especially when the people there are stressful because of the COVID. And just like the meat packing plants down in the southern parts of the state, those workers worked in various plants. So if you got it in one of the plants, you were probably going to infect people in the other plants. And then vice versa, they'd be going to other plants. And so it spread fairly quickly. In the governor's shutdowns, he shut down businesses, schools, related shutdowns as well across the board. It's important to remember that when Walz went into this, and his team, meaning all of the department heads, everybody else, even the people advising him, it's Mike Osterholm in the background there, who's the epidemiologist kind of czar, certainly of Minnesota, if not a very highly ranked national figure. They didn't have a playbook. Mike had a playbook that he had put out a few years ago, but it was a lot like 9/11, where government officials were trying to determine what's the best route forward. There was no desire to, ruin people or anything else, but certainly if indeed your Governor Walz and the University of Minnesota and his public health department come out with predictions that there's going to be 75,000 dead people, you start to really wonder how much you're going to have to cut back. We've been fortunate in that the numbers are significantly, way better than what was originally thought. Minnesota itself was one of the businesses that were named an essential service, and I wanted to go through some of the work that happened. So early in March, when they started looking at closing restaurants and things like that, where there were a lot of contact, they also started to have contact with the industry. And for 10 days solid leading up to his order 2020, we were meeting with the Department of Commerce, the governor's team, Minnesota Department of Health, trying to figure out ways that we could keep the industry going. And the biggest stumbling block, meaning the area where they saw the most opportunity for spread of the disease, was through open houses. Because again, their view of open houses are, you put a sign out, you're inviting all kinds of people you don't know into a property, you're just going to walk around, you're going to be close to them while they're in there. The thought at that time was the disease could easily be transferred by touch on hard surfaces. A lot of that started to go away. But there was significant concerns about open houses. At the same time, as an industry, being around the industry for a long time, we understand the value of open houses, especially in a spring market. And we talked with the big brokers over a weekend. In fact, I had all the big companies in the metro area and John Mosey with the RMLS. We had conversations over the weekend knowing that he was going to be coming out with his order 2020, which was going to be a full stay at home, a full lockdown. We had challenges with the builder community. We're licensed under 2 different agencies and the industries couldn't agree. To the credit of the Builders Association, their largest and biggest marketing event of the year is the Parade of Homes. And after the first weekend, they shut that down. And they had significant dollars invested in that, but they did shut that down right away. Many of the builders are represented by realtors. So in lieu, a lot of their open houses as well going forward were shut down. And we still had some builders, the big builders, that had staff that kept theirs open, but they were using all kinds of methods to try and get people in. We didn't know exactly on Wednesday that the governor's order was going to include us or not, but we were fortunate. I put up on the screen item HH, real estate transactions. This category is limited to workers who facilitate and finance real estate transactions and real estate services, including appraisers and title services. So that was, great news. Talked to lots of people. We're toward the end of March at this point in time. Talked with the commissioner, thanking him for the service that his team did, because they were not only dealing with our business, but all of the regulated industries. So the haircut people, the nail salons, the insurance industry, which is bigger than ours. They were dealing with the concerns of all of those industries. Other parts of it, though, were question marks as we move forward. which is, are home inspectors included? Can you do a home inspection? Can stagers, can photographers, and et cetera, and et cetera. People had different parts of the industry that they wanted to have included. We got inspectors in about a week. I think it was 3 weeks so we could get photographers in. Stagers, we were never able to actually get in on the original order, saying that they were there, because again, most of the people that work for the government are really trying to lock down the society at that point in time, because they're fearful about the number of people that would potentially pass. At the same time, we put together a whole bunch of resources for people. We kind of took the point on that. It's a statewide issue, and whether you're in the metro area or you're in Duluth or Mankato, wherever it is, you still needed the same information. And so we coordinated with our 18 local chapters throughout the state, and the RMLSs all shut down their functions for open houses, because that's the deal we cut with, you know, the governor's team and the Department of Commerce. Our forms committee met right away to release a new form, so that if there were transactions in process where somebody was going to get laid off or they weren't able to get a loan as quickly, what was it that could happen and move forward? So the forms committee, the fastest they've ever got a form up and onto the internet site for people, Instanet, worked out good. We then went in and started doing interpretations and guidelines of what the law meant and what kinds of things people need to think about. And I want to spend just a few minutes here, because a lot of times agents will come to us and say, well, we need you to tell us what we have to do. And we're really not, as a trade association, in a position to do that. The reason is that it establishes what's called a standard of practice. Each of you are independent contractors affiliated with a brokerage. The brokerage can say, in order to be affiliated with us, you have to do this or you have to do that. But if for a trade association who doesn't have a business out there, who's not running a business, we're not in a position to tell you this is what you have to do. We can say, here's some guidelines, things like that, but we don't want to be in a position where we're giving directives unless we're 100% sure of what and how that's going to be impacted. And the reason is so that you don't get into a situation where you're brought up on charges, especially potentially a civil lawsuit, where somebody brings as evidence what the Realtor Association said the industry is supposed to do. And that's the real reason. And I'll remember way back in, I don't even remember when it was. I think it was the early aught years, there was an issue about, what are they? Those clams or those snails, you know, that get into lakes. I forget what they're called, but they're really sharp and they cause water problems. And a newspaper person said, is that something that needs to be disclosed? Now, in my mind still, yes, it needs to be disclosed. But I heard from a number of real estate brokers saying, you can't say that it must be disclosed. You could say, probably a good idea, but don't say must, because you establish then a standard of practice whereby in court they'll bring that forward. And we don't want to be in a situation where we're at cross means with our members. We want to make sure that our members understand what they should do, and hopefully they'll be able to follow through, but there are certainly times where that changes. Within the work we've done on continual changes and things are happening, we have our COVID FAQs up there for you. If you go to our website, you'll find lots of information on COVID, whether it's association stuff, whether it's state stuff, whether it's national stuff. And there's links and dates on most of that so that you can easily see what's the most updated. And then we've recently just put up the preparedness plan. All of you are independent contractors, so you need a preparedness plan moving forward on how you will interact with consumers. The governor said he was going to be coming out with a policy for each of the departments, each of the agencies, to tell their licensees what they need. We have weekly calls with the Department of Commerce, and Commerce has said they're not going to do that. We should follow the general practices and recommendations from DEED that they have established and the CDC. So our staff, especially Susan Diori, who's an attorney on staff, we've got 3 that are reviewing this stuff, has put together an 88-page, 88-page preparedness plan that takes everything from Minnesota and from the feds into account for preparing yourself when you're meeting with consumers. And the preparedness plan is not required to be sent to anybody, but it is required that you submit it if requested. And the most likely way that that will happen is somebody you come in contact with has COVID. And they either trace down you and say, hey, you're a real estate person. We need to know who you've been in contact with, and we want to know what your preparedness plan says for your contact with these individuals. And we would like you to send us the preparedness plan, right now. And you want to be in a situation where you have a plan, that you're following the plan. And it covers lots of stuff, but it's all based upon businesses that interact face-to-face with consumers. Could be an open house situation, could be a showing. Lots of times you come in contact with people, and that's what that preparedness plan is for. And go online, it's fascinating reading. We have to use it. Your association has to use it. Your broker has to have one. Some people think that you don't have to have one if you're self-employed, or that the broker doesn't have to have it because nobody's coming in the office, and that's not correct. You need to have one put in place. New normal for the real estate market going forward and right now. Virtual showings are here to stay. They were already a large part of the business. I think that they will be a significant piece moving forward. I don't think that consumers will want you to go backwards. I would think that technology is going to come down in cost, and more consumers are going to view properties through virtual showings. That'll probably mean limited open houses for at least the next 18 months as they try and come up with a vaccine or something. Important note on that. They don't have a vaccine yet for SARS or MARS. And in fact, the quickest they've ever come out with a vaccine was 4 years. Now, technology is a lot better today, but they probably won't come out with a vaccine as fast as people think. Instead, what they'll do is they'll come out with treatments that treat the ailment and allow you to continue, moving forward, and especially address seniors who seem to be the most impacted by it. Senior citizens in nursing homes are going to be a problem for us going forward. Not so much the nursing home, but the senior citizen that lives in a single family home that should be going to a nursing home now has another reason they don't want to move into one. There's a lot of people in their late 70s, early 80s, even late 80s that are living in single family homes. Some of them physically should not probably be there any longer. And nursing home is obviously the step that would be appropriate for their physical conditioning. They're afraid to go there for 2 reasons. One, they don't want to admit that they're at that point in their life. Certainly, I think all of us could understand that. But the second part now is they certainly don't want to move in and have a much higher chance of catching COVID. That will impact our inventory issue even more going forward, but we'll talk about that. Working from home is going to be a trend that we're going to see more from. Businesses that have been allowing their employees to work from home, almost all the studies now show that workers are actually doing more work from home, or are at least as effective working from home as they are working from an office setting. Zoom is becoming a much more common way for doing meetings and things like that. I don't think you'll see a stop in that. But I think what you'll see is businesses saying that their employees that are not frontline, so not the person that meets you when you come into the office, and not the person that works in a retail store that needs to help you find stuff or ring up sales, but some of my staff, there's not a need for them to necessarily come into the office for a full day schedule. They could easily come in for 4 or 5 hours a day, and that shifts commute significantly. So instead of saying everybody needs to be here at 8:30, maybe everybody should be here between 9:30 and 10, and we'll start releasing some people at 3 o'clock, so long as they can still take calls and answer emails and those kinds of things. There'll be a lot of businesses that start to look at that, because that commuting time is a large problem within the metropolitan area, especially for young workers with children who are sitting in an office and it starts to snow on January whatever, and it's o'clock in the afternoon, and they know we're probably going to get 2 inches of snow, which doesn't slow us down, but it sure bogs up traffic. And that kind of a situation is going to cause problems going forward. So, because the employee just sits in the office and worries about picking up their kids at daycare and having to pay some astronomical amount for every minute that they're late. I think employers are going to start to shift that and say, you know what, we're going to be more flexible with that as long as the work is getting done. Tall buildings versus low buildings. There's a lot of conversation right now about how to handle elevators. So it's not the rest of the building. Certainly office layouts are going to have to change and things like that, but how do you get somebody up to the 28th floor or the 30th floor or the 12th floor for that matter, and some of the high rises around the state where they're limiting one person because of social distancing per elevator. And I think they'll come up with solutions to try and increase that, but that's going to be a costly endeavor, and there's going to be some folks that aren't happy with that. More services obviously will be virtual. I think people are getting a lot more accustomed to using Zoom and webinars and things like that. I think meetings especially will be more focused on this because it takes into account your time and makes it easier for you to participate. I think that'll happen as well with the services for real estate. I've been around since '85. I can remember presenting purchase agreements at night on tables with people sitting there, including the other agents. And obviously all those services, all those kinds of things have gone since we've got electronic forms and things. I think you'll continue to see a lot more virtual, which I think is going to be a challenge for a lot of agents who build good personal relationships. As you get away from person-to-person contact and enter more of a virtual world, some of that may start to cause some challenges. Purchasing sight unseen, we've seen a lot more of this right now, and I think that'll continue because the virtual showings will improve. Inspections will happen. I think you're going to see a lot more people willing to purchase sight unseen, especially where areas where inventory is very low. Purchasing without listing. What I'm meaning by that is I know there's companies out there now that are purchasing homes from sellers directly, not putting them on the general marketplace, taking them with, you know, whatever they want to leave behind. They don't have to fix up the house. That's going to be a certain segment of the marketplace going forward. They're mostly looking at baby boomers and the World War II generation who have accumulated lots of things over time and are sure that their children are going to want them down the road. And it's not going to happen. If indeed you're not sure, I'm not that old yet. And I've already tried to give away stuff to my kids and they got no interest in any of it. It's like, really, you don't want this? No, throw it away. That's going to continue. So I think those companies are going to start to have a larger impact on the market where they go in and purchase properties, gut them, place carpeting, and spend a few $1,000s and then remarket them to especially an inventory short marketplace. Larger home ownership gaps, everyone's going to talk about it. I'm going to say that I think it's going to be a challenge in the short run to overcome that. There's going to be a lot of employees that were especially service employees that are going to have a gap in their earnings. I know that they're saying that employer or mortgage companies aren't supposed to take that into account, but I think that's going to be unlikely. Most of the people that you're dealing with probably were employed fully throughout the COVID situation, and I think that they're taking advantage of the really low interest rates and things like that. Shopping centers and gyms, big areas for congregations of people, I think are going to be challenged in the future. Shopping centers were already in a difficult position with a lot of the large retailers, Sears, Penny's, the Gap. I mean, a number of stores are in difficult shape right now as Amazon and the Amazon type of purchasing takes over the world. Shopping centers are going to have to try and figure out how they will move forward with the situation. gyms, lifetime fitness kinds of places are going to be really challenged. They have huge buildings. Whether or not people are going to feel comfortable going back into those places in the short run will be a big issue for them as they try and slowly meet. And then in the real estate business, again, meetings and continuing education and things like that, I think are going to be a lot more online. Inventory levels, we think, are going to remain low. This is not the same situation as we had a few years ago related to the recession. The recession was a lot different. So we're not looking at another recession situation for the real estate market. Biggest difference is our inventory levels. Going into 2008, we had a high inventory level, especially in the new construction marketplace, where they were actually overbuilding. They were building more units than consumers would actually be able to purchase. We're not in that marketplace. The builders have never come back fully to where they were in the early years. And as you know, especially in the 200 to 350 price range, it is very difficult in some markets to find any properties. That will continue, and that means that prices will hold up because there's a lack of inventory that'll help. The eviction / foreclosure orders that were given by the federal government and then tagged on by the state government are going to help keep people in housing, especially on the foreclosure side of it, where mortgage companies will probably just add those payments onto the back half. That's not in the legislation now, but all of the federally guaranteed loans, that is their mandate moving forward, is just take those payments and tack them onto the back of the loan. That means we won't have a glut of foreclosures on the market. For those of you that were in the market during the recession, we had tons and tons of foreclosures. Almost half the marketplace was foreclosures. We won't see that this time. We will see an increase, but I would imagine it's going to be less than 10%, probably much more around the 6 to 8% level. Federal government loans, the PPP and the EIDL loans that are out there, that's helping people. And again, we didn't have those tools during the recession. So once, the recession hit and businesses started to close up and stuff, there were no loans to try and keep businesses in place during what was seen as a short-term COVID problem. And then the direct payments that the federal government has made, whether it be the $1,200 a person or the $600 plus a week payment that they're giving to people, that's a lot more dollars that's flowing directly to consumers and small businesses to keep them afloat during the COVID situation. The layoffs that are occurring are not as detrimental to the industry as they had been earlier. Most of the larger businesses, white collar office kinds of jobs, they kept going throughout it. And the anticipation is that those kinds of jobs are going to keep the marketplace going. Service sector jobs, restaurant workers, restaurants, retail, especially small retail, although you've seen headlines with a lot of large retail, small retail is going to have a difficult time coming back. Any of those businesses that were kind of on the bubble before we went into the COVID are going to continue to be that kind of a situation because really they were already in limbo and this basically pushed them over the edge. So that's out there. The pent-up demand is very strong right now. And for those of you that were around during the early years in the late 90s, funny money loans are out of the marketplace. So there's no more buy a house and get a rebate, and the no down deals are very far between. Credit's checked out much more stringently than it was. There's no more liar loans and things like that. So we do not anticipate that there'll be any kind of recession for housing. Showing activity is very high compared to where it was even last year. So we anticipate that we'll lose some members. We lose members every year, but we don't think at the end of the year it'll be any more than 5%. So that's kind of the number we're banking on. We're adjusting our budgets that way. I've been on calls with other state AEs around the nation, and I think 11% was the highest that we heard, and I think that was New York. But as you know, New York was significantly impacted and still dealing with a lot of difficulties. A lot of the other states are less than 5% losses that they're anticipating. So marketplace should be good. We don't anticipate anything challenging going on in the future, other than make sure that you've got your preparedness plan in place so that you can be ready to deal with consumers. So with that, I'll turn it back over to Danelle or Jennifer or Luke, whoever is in charge. Happy to take any questions that might be out there.
We do have a question box. Otherwise, you can raise your hand if you have questions, and we're able to give you the ability to speak.
There you go, all encompassing.
Covered a lot. Thank you. And I mean, it was
Just
very
don't let an alarm go off, because then they'll wake up and know that it's over.
Yeah, it doesn't look like anyone has any questions.
All right. Well, I encourage people to go to the website, that COVID-19 spots that we have up there, and review that preparedness plan and other things like that. And appreciate being on today. Thank you very much, and hope everybody has a great week.
Thank you.
Thank you, Chris.